General adult tests, screening for colorectal cancer. Colorectal or colon cancer is common worldwide, mostly affecting those over the age of 50. Screening tests are designed to identify early stage cancers, which have a better chance of being effectively treated. Specimen tubes sit in a machine that automatically carries out fecal immunochemical tests, or the FIT. So this is an automated test to look for the presence of blood in the samples. Fecal blood tests. There are two tests that look for non-visible blood in stool, which could be a sign of colorectal cancer. The fecal occult blood test, FOB, and the fecal immunochemical test, FIT, both require a fecal sample. The FOB test requires the user to collect a stool sample on 3 separate occasions and wipe a small amount onto a card enclosed in a test kit. The FIT only requires 1 sample, which is collected on a stick and put into a plastic tube. Follow the instructions carefully to ensure accuracy. The results may be normal, no blood noted in the stool, which will require no immediate action, unclear, which would require a repeat test, or abnormal, blood found in sample. An abnormal result may or may not be caused by colorectal cancer. In this case, you would be asked to have a colonoscopy so that the lining of the colon can be viewed. Colorectal screening uses a technique called colonoscopy. A thin, flexible tube with a camera is inserted into the colon through the rectum to identify and remove polyps that could turn into cancer over time. The test takes place in a hospital or clinic. Information about the test and an enema or strong laxative to clear the bowels are given to you several days beforehand. You may be advised on dietary changes to make prior to the test, and you will need to use a laxative the day before the test to enable the bowel to be as clear as possible. During the test, the camera is inserted into the rectum and moved into the colon, after which some air is used to inflate the bowel. If any polyps are found, they would usually be removed during the same procedure. The colonoscopy screening is done under general anesthesia, and it is not usually painful. Any polyps removed are sent to a laboratory for testing. You will be told that polyps have been sent for analysis on the day of the procedure. If a polyp is found to contain cancerous cells, you would be sent to a cancer specialist for treatment. If the polyp is found to be non-cancerous, you will be advised to repeat the colonoscopy in 3 to 5 years. During a colonoscopy, the entire colon, also known as the large intestine, is examined. During the test, a patient lies on their left side and flexible scope is guided through the rectum into the colon. An anesthesiologist will also be present to administer general anesthesia and monitor your vital signs. Thank you for your attention.
Let's now go to pathology of yin and yang imbalance. Let's discuss imbalance of yin and yang. An imbalance between yin and yang is a fundamental aspect of Chinese pathology. Indeed, it could be said that all clinical manifestations and all types of pathology ultimately boil down to an imbalance between yin and yang. That is, every pathological situation could be described as one of 4 situations: an excess of yang, a deficiency of yang, an excess of yin, and a deficiency of yin. We can see here in the diagram the preponderance and weakness of yin and yang. For example, heat or fire are an excess of yang. The deficiency of yang of the spleen and or kidneys is of course a type of yang deficiency. Full cold is an excess of yin. Deficiency of kidney yin is a type of yin deficiency. Please note that the parameters used when describing excess of yang and deficiency of yang, similarly for excess of yin and deficiency of yin, are not the same. In fact, excess of yang indicates not an excess of normal yang qi, but the presence of a yang pathogenic factor, that is, heat. In contrast, deficiency of yang denotes a deficiency, a lack of normal yang qi. In other words, yang in excess of yang indicates a pathological heat. Yang in deficiency of yang indicates physiological heat. Similarly, excess of yin indicates not an excess of normal yin substances, but the presence of a yin pathogenic factor, that is cold, dampness, blood stasis, or phlegm. In contrast, deficiency of yin denotes a deficiency of yin substances, fluids, and essence. Blood is also a type of yin substance, and blood deficiency is a type of deficiency of yin. In other words, yin, in excess of yin, indicates pathological cold, dampness, blood stasis, or phlegm. Yin in deficiency of yin indicates the physiological yin substances, the fluids, the essence, and blood. Please note that these four pathological situations are not necessarily mutually exclusive. For example, a deficiency of yang of the spleen and kidneys often leads to the formation of phlegm, which in itself is a form of excess of yin, as it is a pathological accumulation of fluids, although it should be stressed that phlegm can be associated with heat, but this usually happens as a long-term development of phlegm. Similarly, a deficiency of yang of the spleen and kidneys often leads to the formation of edema, which in itself is a form of excess of yin, as it is a pathological accumulation of fluids. We can see in the diagram here the deficiency of yang associated with excess of yin. In summary, the four imbalances of yin and yang, the excess of yang, deficiency of yang, excess of yin, and deficiency of yin. Thank you for your attention.
Stomach 29, Kui Lai, the return. Located on the upper abdomen, tooth zone lateral to the anterior median line, fourth zone inferior to the umbilicus. Stomach 29, Kui Lai, relieves stagnation of blood, an important point to eliminate stagnation of blood in the uterus and regulate the menstrual cycle. It aids the return of the menstrual cycle. It helps regulate male and female reproduction, infertility, impotence, can help the mind and spirit break through old patterns of stagnation to birth new projects and reap their harvest. Good for menstrual problems, whether it's stagnation of blood, dysmenorrhea with dark clotted blood, endometriosis. Stomach 29 tonifies and raises chi of the middle jaw, so can be used for prolapse of the uterus, can warm cold in the lower jaw, clears lower jaw damp heat. Indications: lower abdominal pain, menstrual problems relating to stagnation, fibroids, uterine prolapse, and postnatally to normalize the uterus. Stomach 29, Kui Lai, can be used to good effect to regulate menstruation so that the cycle may be returned to a more natural rhythm. It can also help to restore the male and female reproductive functions for disorders such as impotence or infertility. The name of this point, Kui Lai, return, is normally understood to refer to its ability to restore the condition of the uterus and genitals normal. According to the essential questions, chi and blood desire warmth and dislike cold. When there is cold, they coagulate. When there is warmth, they disperse and flow. The spiritual pivot states that the blood vessels, nutritive and defensive chi of man, circulate without stopping, in the same way that the stars do in the upper region and the rivers in the lower region. When a cold pathogen comes to reside in the channels as a guest, the blood will coagulate. When the blood coagulates, the channels do not move. The overriding action of Kui Lai, stomach 29, is to warm the lower jaw. most particularly the uterus in women and the genital region in both men and women. Cold may be excess or deficient in nature. As far as excess cold is concerned, the uterus, along with the stomach, spleen, and intestines, belongs to that group of the Zhangfu or extra food that can suffer from direct penetration by exterior pathogenic cold, that is, without initial symptoms and signs of an exterior pattern such as chills and fever, body aches, etc. Injury of the uterus by cold may be due to inadequate clothing or sitting on cold ground or overconsumption of cold foods and drinks, especially during menstruation or after childbirth. Pathogenic cold causes stagnation of qi and coagulation of blood in the uterus and disrupts function of the conception and penetrating vessels, giving rise to amenorrhea, irregular menstruation, uterine masses. Qui Lai, stomach 29, is one of the primary points to warm the uterus and drive out pathogenic cold. As far as deficiency cold is concerned, Qui Lai, stomach 29, is also an important point for treating disorders due to decline of kidney yang, which generates cold, giving rise to irregular menstruation, amenorrhea, infertility. The ability of stomach 29 to treat such disorders derives from its action of warming and benefiting the uterus rather than by directly tonifying kidney yang. Qui Lai, stomach 29, is also indicated for running piglet qi, which may arise when kidney yang deficiency leads to accumulation of cold in the lower jaw. Amenorrhea may be due to either excess or deficient patterns, stagnation of qi and stasis of blood, pathogenic cold, phlegm stagnation, blood deficiency, kidney deficiency, or heat pathogen, which consumes yin blood. Due to its action of returning the menstruation, Qui Lai, stomach 29, is commonly used in the treatment of amenorrhea due to any of these patterns. The genital region in both men and women is equally susceptible to attack by pathogenic cold, giving rise to pain and retraction of the testicles, penis, or vagina, as well as being able to warm and scatter excess cold in this region. Qui Lai can firm and warm the lower jaw and is used in the treatment of impotence, seminal emission, leukorrhea, and nocturnal urination due to decline of Mingmen fire. Although the clinical manifestations will be somewhat different in each of the above situations, most will be characterized by aversion to cold and preference for an amelioration with heat. Since Qui Lai is mainly indicated for cold patterns, it is particularly suited to treatment by combined needling and moxibustion. Thank you for your attention.
Let's now go to stomach patterns. Let's discuss stomach yin deficiency. This concept is due to the insufficiency of stomach yin failing to moisten and nourish the stomach. If a deficiency heat pattern is not obvious, it is also called the stomach dryness pattern. Key symptoms are common symptoms of stomach diseases and the symptoms of yin deficiency. In clinical manifestations, a dull pain in the epigastrium, anorexia, fullness in the epigastrium, no appetite or intake of food, but yin deficiency with stomach heat results in swift digestion with increased appetite, retching, hiccups, dryness of the mouth and throat, dry stool, scanty urine, a red tongue with little moisture and diminished or no coating, and a thready and rapid pulse. The analysis of this pattern is mainly caused by the consumption of stomach yin by febrile diseases, by emotional frustration leading to depression of qi, which then which then turns into fire to injure stomach yin, excessive vomiting or diarrhea consuming body fluids by excessive intake of acrid, spicy, or hot foods, by eating too late in the evening, or by taking too many warm herbs consuming stomach yin. In here, the analysis of stomach yin deficiency pattern, when it fails to moisten and nourish the stomach, there will be a deficiency heat in the stomach, and then there would be dull pain in the epigastrium and epigastric fullness. If there's failure of intake, there would be hunger but no appetite. If the stomach chi counterflows upward, there would be retching and hiccough. When when it's in the yin deficiency generating interior heat, if the yin fluids fail to rise to nourish upward, there would be dryness of the mouth and throat. If it fails to moisten the intestinal tract, there would be dry stools. Also, there would be scanty urine, red tongue with little moisture and diminished or no coating, a thready and rapid pulse, are signs of a yin deficiency pattern. The comparison of stomach yin deficiency and dryness of the large intestine. If the stomach yin deficiency pattern, the location would be in the stomach. The pathology would be insufficient stomach yin fails to moisten and nourish the stomach and prevent stomach chi from descending. The clinical manifestation common symptoms would be dryness of the mouth and throat, dry stools, or red tongue with little moisture. For different symptoms, there would be dull pain in the epigastrium, hunger but no appetite, epigastric fullness, retching, hiccough, diminished or no tongue coating, at ready and rapid pulse. If the pattern is dryness of the large intestine, the location would be in the large intestine. The pathology is deficiency of fluids in the large intestine, fails to moisten the intestines. The common symptoms would be the same, and the different symptoms would be constipation, dry stools, and difficult defecation, defecation once every several days, a dry mouth or foul breath odor, a yellow dry coating, a thready and rough or choppy pulse. The stomach yin deficiency etiology: eating late at night, skipping meals, eating on the run, worrying while eating. The underlying accompanying pathology would be stomach chi deficiency, stomach spleen chi deficiency, spleen yin deficiency, kidney yin deficiency, stomach heat, fire, or damp heat. The signs and symptoms would be poor appetite with little desire to eat, constipation, dull epigastric discomfort or pain, dry lips, mouth and throat, especially in the afternoon, slight feeling of fullness after eating, thirst, dry stool, dry scanty urine. The pulse would be floating and empty on the right middle position and rapid and fine. The tongue would be peeled in the center and a possible midline crack. The treatment principle is to enrich stomach yin and harmonize the stomach. The acupuncture treatment are REN 12, which supplements stomach yin, stomach 36 supplements stomach chi and yin, spleen 6 supplements stomach yin, nourishes fluids and clears empty heat, spleen 6 nourishes yin, clears empty heat, bladder 21 supplements stomach and spleen chi, stomach 44, which harmonizes the intestines, kidney 6 nourishes the yin, spleen 3 nourishes fluids, bladder 20 supplements spleen, the stomach 25 stops diarrhea and regulates intestines, and needle with supplementation. Relevant advice: when there is stomach yin deficiency, it will be beneficial to eat foods that are wet and sticky. Things such as porridges, purees, soups, and stews will therefore nourish stomach yin. Foods that are dry in their consistency or in their energetic dynamic will do the opposite and have a negative effect on stomach yin. Foods that are drying in their energy are those that are very spicy, the spicy taste disperses and dries, or have been baked in the oven for a long time. This means that a person with stomach yin deficiency should try to avoid crackers, rice cakes, toast, baked vegetables, and similar items. Deep dried and grilled foods have a very hot energy, and this can also injure stomach yin. Alcohol, too much meat, especially lamb, and spices such as chili, garlic, pepper, and so on, all have a hot dynamic, which can damage stomach yin in the long term. Apart from being aware of what they eat, a person who is stomach yin deficient should pay close attention to how they eat. They should try to eat in as tranquil surroundings as possible, which means that they should not eat whilst working or driving, when they are stressed or whilst they are doing something else. They also need to rest and not exert themselves after they have eaten. They should not eat late in the evening and they should not eat too much at a time. Thank you for your attention.
Diagnosis by 8 fundamentals, diagnosis of deficiency excess. The deficiency strength dimension concerns the relative rise and fall of evil and genuine qi in the ill body. Deficiency means deficiency of genuine qi. Strength or excess means strength of evil qi. In the differentiation of deficiency strength, an illness of deficiency is one in which genuine qi of the body is relatively deficient, but evil qi is not extremely strong. An illness of strength is one in which evil chi is too strong, but genuine chi has not been depleted, so that evil chi and genuine chi are still engaged in fierce battle. Differentiation between deficiency and excess, and understanding of the relative rise and fall of genuine chi and evil chi are the basis upon which the physician selects whether to use the therapeutic principle of restoration or that of catharsis. Deficiency is a general term applied to all clinical conditions in which the body's genuine qi is weakened. It arises mostly from poor prenatal endowment, inadequate postnatal acquired nourishment, or attrition by a variety of illness or injury. In all these conditions, one or several of the following aspects of qi or qi activity may become deficient or show reduced activity: yin-yang, qi, blood, fluids, essence, marrow, and the functional activities of the visceral organs. Thus, the range of illnesses of deficiency is very broad, including deficiency of qi, insufficiency of blood, deficiency of yang, yin deficiency, and insufficiency of one or more of the Zangfu organs. The clinical presentations can be equally varied, though they all share certain common characteristics. The patient's bodily constitution tends to be weak, the mental status lethargic and dispirited, and the voice soft and respiration shallow. There is often pain that is alleviated by pressure. The tongue tends to be tender with a thin or scant coating, and the pulse tends to be forceless. Clinically, Chinese medicine classifies illnesses of deficiency into categories: deficiency of exterior and deficiency of interior. Deficiency in exterior. There are two main varieties of deficiency of exterior. In one variety, the illness results from attack in the exterior by exogenous wind. The characteristic symptoms are wind aversion, sweating, and a floating and even pulse. This pattern indicates illness of exogenous exterior deficiency. In the other variety, there is deficiency of lung and spleen qi, so that defensive qi is unable to secure the superficies from spontaneous sweating, and susceptibility to attack by exogenous evils. Such patients tend to fall ill readily and often upon exposure to exogenous pathogenic evils. In addition to the typical exterior symptoms, the pattern characteristically includes syndrome of qi deficiency, such as fatigue and weakness, shortness of breath on exertion, decreased appetite, loose feces, and a thread-like and feeble pulse. Deficiency in the interior. This large category comprises all illnesses of involving insufficiency of any of the visceral organs or deficiency of yin-yang, qi, or blood. According to the nature of cold or heat, deficiency illnesses in the interior fall in two broad groups: deficiency cold and deficiency heat. In deficiency cold, the body's yang qi is deficient, so that endogenous cold develops. Hence, it is also known as yang deficiency. In deficiency heat, the body's yin blood is deficient, so that yin is unable to restrain yang and permits endogenous heat to develop. It is also known as syndrome of yin deficiency. Excess syndromes or strength syndromes. An illness of excess is a general term applied to all clinical conditions in which an exogenous pathogenic evil has attacked the body or products of pathological processes induced by the exogenous evil linger in the body. It applies generally to the initial or mid stages of illnesses and usually has a relatively short course. In this context, strength refers to the strength of evil chi. Because of the variety of exogenous evils and the many different responses of the body, the clinical manifestation of strength illnesses is highly variable. However, in general, in a patient with strength illness, the constitution is still strong, the mental status is vigorous, the voice and respiration are strong, the tongue is firm and has a thick coating, and the pulse is forceful. The main clinical types of strength illnesses are strength in the exterior, cold strength, and heat strength illnesses. Strength in the exterior. An illness of strength in the exterior, or exterior strength for short, results when an exogenous evil has attacked the body and yang qi has responded by gathering in the superficies to do battle with evil qi. In addition to the standard exterior symptoms, the characteristic pattern of clinical symptoms includes absence of sweating, headache, body aches, and a floating and tight pulse. These are mainly syndrome of cold in the exterior. Cold strength. An illness of cold strength results from strong attack by exogenous cold, which subdues yang qi. Consequently, there are cold aversion, cold limbs, a pallid complexion, abdominal pain with guarding, constipation or borborygmus with diarrhea, coughing with much sputum and increased clear urine. The tongue coating is white and moist or thick and greasy, and the pulse is slow or tight. Heat strength. An illness of heat strength results from strong attack by exogenous heat that transmits from the exterior to the interior. Strong heat scorches the body fluids. Consequently, there are such symptoms as high fever, restlessness, flushed complexion with inflamed eyes, mental confusion with delirium, abdominal distension and pain with guarding, dry feces and dark urine. The tongue coating is yellow and thick or greasy, and the pulse is surging and rapid or slippery and rapid. Thank you for your attention. Documentation strategies, general considerations. Although accuracy is foremost in each provider's mind when performing a history and physical examination, speed of documentation is also important. One strategy that ensures both accuracy and speed is the use of drawings. Frequently, healthcare providers use a stick figure to document pulses and deep tendon reflexes, and use an anatomical drawing of the body or a body part to document the size and location of skin lesions, rashes, or wounds. In many institutions, both the stick figures and anatomical drawings of the body are already on the pre-printed forms, whereas in other institutions, the provider must draw each item. The goal is to provide the best picture of the patient's condition, either in written format or with a drawing, in order to serve as a comparison for future assessments. So we have here a stick figure that is used to document DTRs, or deep tendon reflexes. 0 for no response, 1 plus, sluggish, 2 plus is expected response, 3 plus is slightly hyperactive, and 4 plus is hyperactive. In the documentation process, it is important to only use standard abbreviations. Institutions will have different policies about the use of abbreviations. One institution may severely restrict the use of abbreviations, especially if it has found that the abbreviations have led to medication or treatment errors. Therefore, each provider should check with her specific institution to determine which abbreviations are acceptable. As a reference, both commonly used abbreviations and symbols can be found in many medical dictionaries. Although abbreviations facilitate the speed of recording, the history, and physical examination, remember that the data and information need to be recorded in such a manner that others reading the write-up can clearly understand the information presented. Although many methods of documentation are available, such as direct computer written reports, each new method provides potentially new concerns. As of April 2003, federal guidelines have been implemented to restrict the sharing of patient information either direct or indirectly. Although data can easily be recorded directly into an institution's computer database, this process places an added responsibility upon the provider that computer screens are not left unattended, where patient data can be seen or reviewed by unauthorized individuals. The new guidelines also regulate with whom a provider can share patient information. In addition, HIPAA regulations require the patient to provide consent for his medication information to be disclosed to other individuals. The challenge for the provider is to write an appropriate record of the history and physical examination using the latest technology available without violating the patient's right to confidentiality. The use of email and faxes to share patient information poses an additional problem. Most institutions advise that a disclaimer be inserted at the bottom of any patient related communication that indicates that the following information is confidential. For example, if information needs to be shared electronically, the following disclaimer may be used. The information transmitted within this email or in any attached documents is intended solely for the individual or entity to which it is addressed. The information may contain confidential and or privileged material. If you believe you have received this email in error, please immediately contact the sender and delete the material from your system. Thank you for your attention.
Let's now go to acupuncture for emergencies. Let's discuss burns. For burns, fire, boiling water, and similar, we can use bleeding therapy on the lung 11 point. Use acupuncture on local skin in the middle and around the skin lesion. And then on the UB12, UB13, spleen 10, kidney 9, and SJ5 points. Use herbal tea, Yu Tang, without the herb Xiao Yao, but with Shuti, Longu, and Muli in the formula. Smear on an herbal oil of Muli and herb Dai Huang and the Li Huang, all ground into powder and mixed with sesame oil. If there are blisters on the skin, burn the herb Shi Chang Fu into ash and mix the ash in the oil lotion above to use. Use folk therapy. Use 30 grams of beeswax and 280 ml bean oil. Mix the wax and oil and melt. Clear the wound and smear the paste on the affected skin. If there is no bean oil, simply smear clear honey on the affected skin. Smear soy sauce on the affected skin before you can find some other way for healing. Use soda diluted with sixfold of water. Wash the skin, not broken skin, with the soda water. Use 30 grams of white sugar and 3 grams of bomiol bingtian. Grind the material into powder. Mix the sesame oil to make a paste. Apply to the burned skin. Mix liquor and wheat powder to prepare a paste. Apply the paste on the affected skin. Change it whenever the paste becomes dry. Put old cucumber pulp into the bottle. Keep it in soil 3 feet deep for 1 week. Smear the juice on the bottle on the affected skin. Use old cucumber juice, pulp removed before the juice is made. Grind the cucumber into juice. Smear the juice on the affected skin. Smear pumpkin juice on the affected skin. Smear pumpkin cane juice on the affected skin. Bake wax gourd. Peel until yellow in color. Grind it into powder. Mix with a little sesame oil. Smear it on the affected skin. For scalds, use 100 grams of banana. Grind it into mud. Apply to the affected skin twice a day. Thank you for your attention. Let's now go to fibromyalgia. Let's discuss Coley's space between skin and muscles. In the Chinese medicine, to understand the pathology of fibromyalgia from the point of view of Chinese medicine, we should review briefly the morphology, physiology, and the pathology of these structures in Chinese medicine. First, the space between the skin and muscles, the connecting channels, and the muscle channels. The space between the skin and muscles. Chapter 1 of the Essential Prescriptions of the Golden Cabinet mentions the space between the skin and muscles. It says, one should regulate one's sexual life, avoid excess of flavors in the diet. If not, the body will become weak and pathogenic factors will enter the coli. Co is the space of the triple burner where the original true essence converges. Li is the pattern of the skin and internal organs. The Simple Questions mentions coli in chapter 5, where in one passage it compares the clear yang with turbid yin. The clear yang opens the coli, the turbid yin returns to the five zang. This means that the defensive qi, which is yang in nature, is diffused in the sweat pores, in the space between the skin and muscles. When the pores are closed and the space between the skin and muscles is blocked, the defensive qi cannot be diffused and the upper burner is blocked. This may give rise to fever. When the space between the skin and the muscles is too open, there is spontaneous sweating. The coli is a complex entity that includes two aspects. The co are the spaces in the body which include the triple burner spaces, of which the space between the skin and the muscles is one. The li are the patterns or grains of the skin, flesh, and internal organs. The latter are probably the connective tissues of the body that pertain to the wang membranes. In context of fibromyalgia, the most important co-space is the space between the skin and muscles. Here, the defensive qi circulates, sweat is formed, and the skin pores are regulated. When the space between the skin and muscles is well regulated, defensive qi diffuses normally in the space, protecting the body from external pathogenic factors, and the skin pores are regulated. That is, they open or close at the right times. As you can see in the figure, the space between the skin and muscles. In pathology, the space between the skin and muscles is the space where dampness settles, causing muscle ache, a feeling of heaviness of limbs, and fatigue. Dampness, of course, may also settle in the head, causing dull headaches that are also a feature of fibromyalgia. Thank you for your attention.